Understanding fractal structures helps us develop new medicines. Even with the same medicine, sometimes it works quickly, and sometimes we see almost no response. Our body's reaction is too complicated to explain with a single factor. A fever can come from a virus or from something completely different, such as stress or inflammation. Completely different causes can sometimes create similar signals, so it may seem that the first thing we should do is to question the exact cause. However, trying to examine each cause one by one takes a very long time. That is because our body is so complicated. Researchers try a different approach. Instead of trying to find out the exact cause, they first look at the paths that substances follow inside our body. These paths take the form of repeating shapes of different sizes, like tree branches. This kind of structure is called a fractal. A fractal is not simply a pretty motif. It is like a language that reveals within the tissues of our body how closely the pathways are packed and how intricately they are connected as substances move through them. These differences in structure affect how medicine spreads through the body more directly than we think. In tissues such as the heart, liver, and kidneys, where blood vessels spread like a fine net, medicine spreads quickly. In contrast, in areas like muscle or fat, where the gaps between blood vessels are wider, the medicine moves more slowly. That is why, after a muscle injection, we sometimes gently rub the area to help the medicine spread. In contrast, after an intravenous injection, there is no need to rub the spot. Unnecessary pressure can leave a bruise. Rather than relying only on what we feel, researchers turn these differences into models. Scientists who develop new medicines study how medicines spread through the bloodstream using fractal diffusion models. They measure how much the tissue branches, and based on this structure, they estimate how far and how fast the medicine will travel. What matters is not simply the amount, but time. Some medicines need to arrive quickly to be effective, while others need to remain in our body for a long time. So when we develop new medicines, we consider not only the ingredients, but also the timing of how they work inside our body. This way of thinking also influences the shape a medicine takes. Recently, researchers have been trying to build the structure of medicines using 3D printing. A solid figure close to a fractal structure can hold a large surface area within a small space. This helps us design medicines that are absorbed more quickly in our body. We can also coat the surface so the medicine is released slowly and steadily over time. In the end, the key is how we shape the surface and the paths. When medicine moves through our body, one technology we often use is the nanocarrier. It is a very small carrier that carries medicine, and it is sometimes designed in shapes like snowflakes or tree branches, close to a fractal form. When medicine needs to work quickly, we place it near the surface. When it needs to work over time, we can store it deeper inside instead. Researchers continue to study how adjusting the size and complexity of the structure can match the timing of its effect. Fractals do not appear only in the way medicine moves through our body. They also appear in biological signals, such as our heartbeat, blood pressure, pulse, and even the way we walk. These signals may look simple at first, but when we look closely, we can see small fluctuations and complex patterns hidden inside. So when these signals become too flat compared to usual, or when their patterns change, we begin to think that our body's regulation may have changed. A healthy body adjusts itself little by little depending on the environment and conditions. Brain activity shows similar patterns. Depending on the state of our brain and our level of awareness, the complexity of the signals changes. By studying these features, researchers try to estimate the depth of anesthesia and the state of consciousness. This kind of analysis can also help reduce accidents of awakening during surgery. Fractals give modern medicine a fresh perspective. Even when there are too many variables, if we study the structure, sometimes we can find a path. Even so, there are still few attempts to fully understand this structure. When we face difficult diseases that advanced medical equipment and precise surgical methods alone cannot help, we need to ask a different kind of question. The mystery of fractals hidden throughout our body may be solved not with stronger medicine, but by finding structures that fit better. As we understand this better, the world of medicine will slowly begin to change.